Okay, so my name is Judy Amable, and I am on the board of the National Alliance for Mental Illness
I'm going to ask you to hold this because I think you're having a hard time hearing the phone.
in Boulder County and Boulder and Broomfield counties, and I'm also on the board of Mental Health Colorado, and I'm on the policy committees for both of those organizations.
And she's running for our state legislature.
And I'm running for the state legislature.
Wow.
And I have a son who has a serious mental illness. He has schizophrenia, he has co-occurring substance misuse. And so we have spent the last 10 years trying to figure out how to get him help, and we have found the system to be woefully inadequate in serving the people for whom it is designed to serve. Although maybe it isn't actually a design, it's just an accident that it ended up this way. I helped with the focus groups that culminated in this survey, and so I can give you a little personal color on the survey results. I want to just go back to this. Brief hospitalizations are generally not helpful. My son has been in and out of M1 holds numerous times, and they really don't work. And there is, in the statute, the ability for somebody to stay longer, but in the real world, it just doesn't happen. And it would be helpful for many families to get your person stabilized before they get released. And then, of course, the other thing is that once they are released, there's no follow-up. So you go, you have an M1 hold, maybe you spend 2-3 days in the hospital, and then they tell you, come pick this person up. And they don't have a plan. They don't. Oftentimes, they don't have another follow-up appointment with a psychiatrist. Our son got released from Highlands Behavioral Health on a Friday afternoon. They put him on a new prescription for a drug that we could not get anywhere. We called every pharmacy in the Denver metro area and could not get that prescription filled. He didn't even have one pill in his pocket. He just had a piece of paper. And within 3 days, because it was a holiday weekend, he was back in the hospital on a suicide attempt. So I think there's some regulations around that could be put into place that would be fairly straightforward. And I do hear sometimes, well, we have that. But in fact, you don't have that. We don't have that because it happens all the time. It's happened to me and it's happened to other of the NAMI members. What many people want who have a kid with serious mental illness is for there to be a hospital stay that is followed up by supportive housing with wraparound services. So you go from the hospital, you step down to a place where a residential facility where somebody makes sure you're taking your medications. They get you to your appointments. They help you with your job. And you stay there as long as you need to stay there, not as long as the insurance company wants to pay for you to stay there. Insurance companies should really not be able to practice medicine, and right now they do, and they do it poorly because their incentives are perverse. Then you could step down from that into Section 8 housing or some kind of housing that isn't as intensive as long as there continues to be follow-up services. And we heard that from a whole bunch of our members. We want to have integrated treatment for your mental health issues and your substance misuse situation. And then the other thing, and I know this is very controversial because I've launched it at meetings that some of you here have been at. The family is the primary caregiver for most of these people. And the family has absolutely no ability to interact with the caregivers and to get a voice in their treatment. And I understand that some people don't want their family to be involved. And they absolutely should have the right to say, I don't want my family to be involved. But for many of us, our people aren't well enough to know whether they want us to be involved. And we are involved by default because they live with us and we're taking care of them and we're keeping them alive. But just barely. And it would be hugely beneficial if there was a mechanism for the family to have a voice in the treatment. And I think the other thing that we heard was our educational system doesn't address mental health issues soon enough, doesn't identify mental health issues effectively, and that might be a place to start. I think all of us who have a kid with a serious mental illness spend a lot of time looking back and saying, maybe I blew it. Maybe there were signs. Maybe if I would have done this or if I would have done that, things would be different now. And so we would like for the next generation of families to not have to spend that kind of time on the look back, because there are probably some proactive things that could be happening that aren't. And I guess the other thing that we hear from families is there's a lot of shame and blame. And that is hard to take. And part of the reason it's so hard to take is because we're already ashamed and we already blame ourselves. And so we don't need the system to continue to foist that off on us. That base is covered. We're taking care of that ourselves. So that's my input on our survey. Thank you.